Nested in the heart of the Rift Valley, Uasin Gishu County is Kenya's agricultural powerhouse. Known for its lush green landscapes and chilly highland mornings, it is a land of hard work, resilience, and excellence. But beneath this vibrant soil lies a health system struggling under the weight of non-communicable diseases, maternal health issues, and limited access to specialized care. Uasin Gishu, like many other counties, faces rising cases of hypertension, diabetes, and reproductive health concerns. To respond to this challenge, Mpesa Foundation, powered by Zuri Health and in collaboration with Gladys Bosch-Sholei Foundation, held a comprehensive free medical camp in Keses constituency, bringing healthcare to the people at no cost.
Today we are in Uasin Gishu County, Keses Sub-County and Murgor Primary School, where the all action today was taking place. So we've managed to see over 4,000 patients. Last I checked, it's some minutes to 6 and I can see patients are still being seen as at now. There have been different cases from the non-communicable diseases, these gastroenterologic conditions. There have been issues around the eyes, and the dental clinic was also fully packed. We managed to see different conditions again on that, provide different services. Most women, I want to mention this was different from the other camps, because at this camp I saw a case of fistula, which I've not seen in other camps. And we initiated the referral process. The doctors are following that up, and I believe it will be a noble cause to assist this patient, because without this camp, they could have kept it to themselves and probably not get any solutions around it. So I want to take this chance to thank Mpesa Foundation, Zuri Health, for organizing such events so that most people in these underserved communities can obtain health services and acquire them at simply no cost. The unique thing about this camp, I'd say, is the manner in which it was organized. The setup was impeccable. The mobilization that was done was crazy. So most patients stand up based on the proper mobilization. And again, the support from the county and the partners made it so easy to execute it successfully. At Zuri Health, usually all the treatment doesn't end here. We usually have a follow-up process whereby we give the patients all the package of medication as our number, where they can always reach out to us, and we ensure there is that continuous follow-up and patient is taken into consideration. Yes, so the treatment does not necessarily end here. It's a continuous process. We have partners within the county we can interact with to take care of the patients while around.
What usually happens, naturally, people don't go to hospital until they're extremely sick, because they think, I don't have the resources and so on. But when you have a free medical camp like this, these people are able to have the checkup, understand what they have a problem. Like there's a lady who was thinking she was always feeling tired, she can't work, she can't till her lunch, she can't even cook. But she just had a checkup and they found that she has high blood sugar and she's diabetic, and she's been put on the diabetic medicine, and she's saying she's even feeling better now. She's already been stabilized. So you see, someone like that now has learned what the problem is. And we've explained to her that when the 3 months medication that she's been given for free here under this medical camp, she can now do a follow-up in the sub-county hospital and be able to get the medication. We also have the SHA registration desk here, and Mpesa Foundation has paid for several patients to be able to, for 1 year, to be on the SHA registration for 1 year. So that lady, we've now told her, register for SHA, which means she can go to any sub-county hospital and she can get the medication for free. And they're taking x-rays here on site. They are doing dental procedures on site. They have a whole big bus that is a fully fledged lab. They also have lab facilities where they're able to take blood tests and actually do the checkup right away. And what is even more amazing is that people who need specialized care and opinion, where the doctors on site are not able to deal with it. They are actually on a virtual meeting with doctors in India, where they are able to explain what the patient's challenge is, and then they can get advice for further help. And also what's very unique about this medical camp is that it doesn't end today. There are people who are going to have procedures later. They've taken their data. It's on an online platform, an application that they're using, so they don't have any paper that they're writing down. And all that is entered, and they will be able to call back the patient, find out how they're doing, if the medication is doing well, and if they need further tests, they will be able to refer them to other hospitals. And I think today we've also had a breakthrough with a 13-year-old girl who has a heart condition. She's had it since she was born, and she was supposed to have had an operation 10 years ago. And the parents could not raise the 700,000 shillings that was required. But today, Mpesa Foundation has said that they are going to take her for more specialized treatment, and they are also going to acquire for her, they call it an oxygen concentrator, that can help her to breathe. So, I mean, this has been life-changing. I am so, so grateful to Mpesa Foundation, because you have changed many people's lives. And you've seen how happy they are when you talk to them. So this is at another level. Yes, I've never seen anything like this.
Ninatoka Neri hapa katika Chebayua. Tumeshukuru sana. Tuna changamoto kidogo pale na pale, kwa sababu ukitaka kujitibu unaenda mpaka town. Ukitaka hata kama hii yangu ya macho unaenda mpaka town, lakini tumeshukuru sana kwa sababu wamekuja hapa karibu. Tumeshukuru kwa Mpesa Foundation, wametuletea hii, imekuja karibu. Tunashukuru na tunasema ni asante. Nimeona wametibu hata wakina gogo, wakina babu, wote wametibiwa, mpaka wote wamefurahi, hata pia mimi nimefurahi sana. Niliweza kujua kwa sababu ilikuwa kwa kila mtandao, tuliona kwa kila, hata tulipewa message tulipewa message kwa simu, kila mahali tuliona ilikuwa imenini kabisa, wakatuambia mkuje mkaribie, mkuje mkijitibu kila kitu. Tumeshukuru sana kwa kila jambo, na tunaona madaktari ni wazuri, wanaharakisha, wanafanya vizuri, wanaongelesha watu vizuri. Nimeshukuru sana. Ni vile nilienda kwa hospitali ya macho, shughuli ilikuwa mzuri, nilikaribishwa haraka sana na nikashughulikiwa haraka. Mpesa Foundation nawashukuru sana sana sana, wameweza kutukaribia, wameweza kututibu, na washukuru sana. Nasema asanteni sana, mbarikiwe penye muko, na muende pale pengine kama hapa kutibu wale wengine. Nimepewa miwani na shukuru sana. Nimepewa hii ni ya kusoma, huwa sionangi nikisoma. Nimepewa na nimeshukuru sana sana sana.
Na hapa jana kulikuwa tumetangaziwa na gari. Kuna gari ilikuwa inatangaza medical care iko hapa. Sasa asubuhi leo nikasema wacha niamke, ngoje nijue kifua yangu, boss. Kifua yangu ilikuwa inalia sana. Nikakuja pale nikapigwa x-ray ya kifua. Na mguu yangu pale nilikuwa na kinonda, nimetibiwa, nimepewa madawa hadi ndio hizi. Hii hata inashinda safari. Inashinda Rivaro. Hii Zuri Health yake ni sure. Matibabu inaendelea sambamba, naona kila kitu inaenda sambamba. Watu madawa zote ziko, hakuna yenye unaandikiwa ataenda nunua. Hii unapata kila kitu hapa. Zuri Health iendelee hivyo kutibu wagonjwa. Zuri Health iko sawa na Safaricom waendelee na kazi yao. County hapa sasa changamoto yenye tunapitia hapa ni madawa. Madawa pale health center hakuna, ukienda pale unaandikiwa madawa na unajipata umeenda kweli umepata daktari anakuandikia dawa mara ya 1500. 1500 sasa umepata hiyo 1500. Na hauna kitu kwa nyumba. Sasa utanunua dawa ama utanunua chakula? So utanunua chakula, dawa ikae ikuwe siku zingine. Zuri Health kwanza naambia hao waanze waendelee kabisa, hata wakuja tena waongeze mkono tena kwa dispensary yetu ya pale. Waongeze mkono tena hapo. Aya county yetu tena waweke mkono yao tena pale, walete madawa. Ndio sisi wagonjwa tukienda pale tukitibiwa sisi tunarudi nyumbani kama tumefurahi. Zuri Health iko sawa. Waendelee hivyo, wasikufe moyo.
As at this time, midday, we have hit 2,500 people. This is our 40th medical camp across the country. So our target is to do a camp in every county, so we have a few counties to go. I think it's 40th and 38th county. So we've been doing this, offering services, improving as we go along, because we want to bring medical care closer to the people. So that is the intention of Mpesa, and we work in health, mostly maternal health, and then we believe in prevention. Prevention is better than cure. That's why we do the medical camps, to give communities a chance to come in, be checked, and then be given aftercare services. So we are very happy that we have partnered with the Gladys Bose Sholei Foundation, and she's the one who invited us here, and we've worked together to bring the camp to the people of this area and to be able to support all the communities that need our services in this area.
From fields of maize to fields of care, Uasin Gishu opened its arms to health, hope, and healing. This was not just a medical camp, it was a community standing tall together.